Okay, hi everyone. Welcome to one more podcast from Elitemed. We have two esteemed guests and we have the CEO. So I'd like CEO to start the chat on women in IR today.
Yeah, I think it's a pleasure to talk on women in IR for you both being a part of this talk.
I think all three can introduce yourself.
Yes, ma'am.
I'm
Start.
Yazmin. I'm an interventional radiologist. I think if you guys are interested, my designation is I'm associate professor at Hospital Chancellor Tunku Mukhris. It's a bit of a mouthful, but it's in UKM. It's in Kuala Lumpur, the city of Malaysia. Yes, and I've been in IR for the last 14 years, going on to 15. Yeah.
That's wonderful.
Yeah, I'm old. It's just that maybe I look young.
Yeah, you look young.
You do. I am Dr. Avichala. I am currently practicing in Vedanta Hospital, Gurgaon, and I'm also holding a executive committee post in the Delhi chapter of ISVIR, and I'm very passionate about women being in this specialty, especially, in vascular interventions, because that's what I primarily specialize in.
And I have also heard a story last time in a Sircon.
Yeah,
Is it in the flight?
she's
She's
one
a
of the
famous
national
IR.
heroes.
Oh, wow.
Like they saved a baby in the flight.
Oh my God.
They gave CPR.
Yeah, that was actually when we were coming back from the complication meet,
Yeah.
and there was a crisis in the flight on our way back, and then we happened to save the baby, make an emergency landing. The once in a lifetime kind of an experience, but very satisfying for sure.
But I mean, in reference to this, what I feel is like, we women have that instinct inside us.
Exactly.
How to act on the time, right? And nothing against men, but yeah.
No, this podcast is all about women. So
Yeah.
and we do agree that women do have so many positives more than men do. So I think we can talk about that, how a woman can make a better IR than a man.
I think in current times when there's nobody limiting women, and it just comes naturally. Being compassionate, you can listen to what your patient actually wants from you. It really helps in treating when you're actually trying to understand what is it that you need to do. So because it comes naturally, and there is a sort of a intuitive thing that you can do. IR is such a branch that you need to take some intuitive decisions also, along with the standard guidelines that is already there. So in that way, it helps. Obviously, there are a lot of really well-established male IR consultants, but it's just that in current times, I would encourage more women to come in this specialty.
We have IR since last 14 years doing great work.
Yeah, I started because I've got a good mentor, a male IR, who've seen me, like my enthusiasm, because you'll always, as a resident, can I do this biopsy, that kind of stuff. Can I try this, because I'm interested in that, and that enthusiasm is a bit obvious to them. So I think better channel this energy towards IR. I wanted to be a surgeon, but it didn't materialize. So my hands are a bit itchy and trying to do stuff. Trying to do stuff and poke stuff. I came to radiology because there's no place for me. I wanted to do orthopedics. I didn't get in. I wanted to do ENT. I didn't get in. So it left only emergency and radiology. So I took radiology and I saw this interventional radiology, and I think, this must be it. Yeah, so it's sort of like marriage, perhaps, like what they call jodoh. What we call in Malay is jodoh lah. You meet your
It's a
mate.
destiny.
Yeah, destiny. Yeah. Sometimes
you didn't plan for it, but definitely it's the right choice.
Yeah, it's nice. Is you can visualize and you can do something about it. So I think just like you, when you're interested in something, somehow the energy carries it, and it sort of directs your path towards it. Yeah,
Absolutely.
Yeah, that's very
Okay, one very interesting thing I want to know, like how you said you wanted to do surgery, and then how was your childhood? Like, did you always want to be a doctor, or like what was it? What made you direct towards doctor, and then
I'm an active person. I wanted to be a doctor because I wanted something to do with service. I like people, so I like talking to people and doing people. My father asked me to become a lawyer, but I just looked at the lawyer stuff and I said I couldn't. I want something more science based. So it directs me to become a doctor, something like that. Yeah.
What about you?
It's funny actually. When I was I was getting into the school in the nursery standard. I have a lot of doctors in the family. So the principal asked me, "What's your name?" And I was like, "Dr. Avichala." And she was like, "Wow, this is what my parents told me." This is when I was maybe 2 and something,
Okay,
2
very
plus.
small kid.
Yeah.
Nice.
So probably I was very focused that I want to be a doctor.
So you were throughout in your journey, you always wanted to be a doctor.
I just was very clear. No astronaut, no nothing.
When did you decide to be a doctor? She was at the age of 2.
Maybe after
or so.
high school.
Maybe after high school.
Yeah,
Okay.
yeah.
That's
It's been lawyer, engineer, or doctor. But I think to have excelled in chemistry and biology, so sort of like move my path towards that way. Yeah, but I like people.
But
That's
I
one
think
thing.
Even in Malaysia, it's same lawyer, engineer.
Yeah,
doctor.
yeah.
We have it here
Yeah,
also.
but not at the moment. Yeah,
At the moment, kids just want to be an engineer. So
yeah. They make more.
Times have changed.
times have changed actually.
Yeah. So how is your work-life balance? Like, what do you say? What is the amount of time you work in the hospital?
Right now, because I'm a senior, it's a bit better. But back then, when I was in the fellowship, when I was training, it was very busy, and I think I had the help of my mother because to help me with my kids as well, and especially what happened is I'll send my kid to my mother, and my mother, because taking care of my grandma, has a helper. So and afterwards go to work. And then after work, I came back and my mother will pack me some dishes lah. So when I go at home, I cook rice with my husband. My husband also is very, very supportive. I think I couldn't be an IR without him because he helps a lot. And when I'm on call, suddenly you look at your bed, where's my wife? That kind, and suddenly he called you and it's 3:00 in the morning and your battery phone died and you went panic one day because I had a mechanical come back to me at that time because you don't want to wake up your spouse and things like that. So it works out fine in the end, but like everybody else, male or female, the training period is tough. You need support. Yeah, definitely.
Yeah, and the family support is very important.
Very
But
important.
what I want to know is, training period is always tough. But how tough was it? Like that's what. Like what was your work hours like during your
I
training?
mean, I think
Yeah.
we should also talk about.
Yeah.
I mean, from the women point of view, we should also talk about the struggle that we have to maintain the skincare or the.
I think the skincare went out of the window.
Out of the window, long back. Hydration.
Yeah,
Hydration
true.
is something that we can do.
I stopped buying stuff that's pretty because you wear scrubs anyway. That's it. Yeah, there's no point. It's just make sure that.
We all go to that stage, like our focus is on patients, finishing the work clean, and not. We are never bothered about ourselves.
But still, I can maybe I can just add one thing over here when comparing a woman and a man inside a hospital. The chance of finding the shabbiest one is very rare when it comes to
Women.
female.
They're more clean. They're definitely more clean, more organized. That's
Yes,
mostly.
All doctors are organized and clean. What I was asking you is the timings of work timing. So you had like 24 hours duty.
Yes, I do.
So or like continuous. Like I think
Yep.
she'll give you a better perspective about how she had in India.
Yeah.
So that we all know. But then what about yours?
Yeah.
I think you can tell first.
Yeah, you
what
can
is-
tell.
what
Yeah.
is your
Yeah.
Since she's at the senior level, I'm at the junior consultant level. So I am pretty much always there. We start early morning. We go late as much as it takes.
so
Sometimes.
what time you start?
I leave home at 7. We start for first case at 8 o'clock in the morning, 8:30. First case is inside, and then we finish when we finish. Sometimes there's,
Routinely, what time?
routinely I reach home 9.
9.
9,
But
9:30,
if it goes
10.
beyond, then I think you'll also say. No,
sometimes.
this is now when you're working. I think you
This
have
is-
recently joined new hospital. But
Yeah,
what
yeah.
about when you were in residency? How was the work?
In residency, of course, we have night duties as well. So residency is all the same.
Yeah.
Yeah,
any
But see,
interventional
the
surgical.
doctors know it. Non-medicals don't know how the residency is.
It's
so how many
hard.
hours of duties, continuous duties have you done?
24 hours is a standard, and then we don't get an off, so it becomes 36 hours.
36 hours is
36 hours is a standard. Like
Yeah.
we don't even
I think
like we
the
get
same,
yes, the
even
same.
in,
Yeah,
we get used to like not sleeping, like working without. There is no concept of sleep
Yeah.
primarily when you are
Is
on
it the
duty.
same situation in Malaysia also?
Yeah, when you're training, it's like you're
It's
on
everywhere
call
the same.
the next day, and you're
not
off
sure,
only like
but-
5 or 6, just because
I also
your GCS is like around 15, over around 14 at that time, and you have to go back.
In Malaysia there is
it's a
no
bit-
fixed working hours here.
No, but it's an unwritten rule that when you're on call, the next day you can get off at around 5 o'clock, like that. Yeah, just go.
you will get off early.
Yeah, you get off early. Yeah.
Yeah, some places. See, when the work is very hectic, I think this is how it works everywhere. I suppose.
But then if you're passionate, you are
Yeah.
driven, then
Yeah,
it doesn't
yeah.
feel like that.
No,
Because-
that is why we all have reached here,
I
passing
get-
that phase, not
Yeah.
bothering much about, this is a work hour.
Yeah.
So all radiologists had a very good life, even without doing IR.
Exactly.
But if you're doing IR, that means
Yeah.
You wanted
we are
more.
very passionate.
Very
about
passionate.
it.
But
Exactly.
I found out that interventional radiologists are also good radiologists as well.
True.
Because I have people lining up to me to ask for, diagnosis and decisions. And I said, what do you want me to do? Do you want me to biopsy or blah, blah? No, we just want the diagnosis, because we've seen a lot and we've got good feedback, This is like this because we've done it like this and became like this, and because we've got a good feedback mechanism in IR. So we become good diagnostician as well. And when people ask favors, we are the ones who give, because we are friends with all the specialties, the surgeons, the ENTs and things like that. So it works very nicely. I think IRs have more friends, and because we save a lot of assets anyway, the surgeons will, oh, sorry, can you help me? There's bleeding, I couldn't stop. Can you please embo this? So I think that's the satisfaction. Yeah. It's very nice.
Very satisfying.
Okay. So I heard that you are into vascular interventions.
Peripheral
Yeah,
vascular,
peripheral.
primarily.
Yeah.
I was trained in that, and I'm practicing that.
So there is one branch called cardiovascular.
Yep.
Cardiovascular and cardiovascular.
Imaging and endovascular
and imaging and
intervention.
endovascular
Yes, yes.
intervention.
Yep,
So they mainly do the vascular work.
Yeah, like lower limb and things like that.
Lower
Everything,
limb,
aorta, peripheral,
So, yeah, we-
embolization
carotid,
as well.
embolizing, anything vascular.
Yeah.
Non-vascular GI.
Ah, I see. So
We
in my
have
center-
3 teams actually. In Medanta, we have 3 teams. One for neuro, one for peripheral, one for GI and non-vascular.
Okay.
Essentially.
Yeah, we do all, I think, top to toe.
Yeah. So
Yeah.
your spectrum is like
At first, I wanted to do neuro, but in my center, they said they wanted an interventional oncology. But at that time, there was no people who's doing lower limb and EVAR and TVARs, so I did that as well. And then when I found another person to take over that, I can still do it, no problem. And then so I ventured into interventional oncology, because interventional oncology are expanding, especially when we're going to introduce last time radio embolization and TACEs and all these ablations coming up and things like that. So I'm the first Malaysian to start TheraSphere in Malaysia. Yeah.
Oh, nice.
I'm the one that bring it up, because that's one thing lah. So we do it all. Right now I train a lot of IRs, but I do stroke calls. Yeah. So yeah.
So, but how does it feel like when you're doing a full spectrum of work and like some spectrum goes. See, as a
Yeah, yeah,
passionate
yes,
IR,
yes.
you always want to keep doing. It's not about
No, but
you'll
the-
never get tired of doing
Yeah.
things. But
it goes. You follow your passion. Yeah, you follow your passion quite well. I think one of the when you see people have a lifespan of 10 years because of your interventional oncology, then it's very satisfying. You know, we keep one patient. There's one patient. We do ablation and multiple TACE and radioembolization, and he's well for the past 10 years after a diagnosis of hepatocellular carcinoma. So it's very nice, and we bring him towards liver cancer awareness, and we told him, you know, IR can do this. Yeah, things like that. Yeah, but I think I had a hard time doing, trying involve myself into the peripheral interventions world. Whenever I go to link, like all this, it's like when I go there and people say, excuse me, the vendors area is over here. Actually, I'm an interventional radiologist. I'm going for a dinner with the vascular surgeons. You know, they couldn't see me as a vascular surgeon and IR, and especially one with hijab and things like that, and a lady. So they pushed me away. And that happens in aortic Asia, you know. They think I'm a vendor.
Maybe it's time.
this does happen sometimes because people are not aware that her experience, she's running her own residency. People are not aware of these things. That
People are not
this can
aware.
be done by women in IR. So no, that's I think this is. But women are more empowered in IR. I feel compared to any other branches.
Women are more what?
More empowered.
Empowered. I think with the current times, there is nothing limiting women. It is their own choice. It is their own, instinct that is limiting, if at all. People are not very,
What I feel is when it comes to IR, when it comes to the patient care, it's not only about just delivering that procedure or anything. It's like understanding that situation and being empathetic towards the patient and then delivering that procedure to them.
Yes.
I think women has that inside.
Yes, you have to be
it
that
comes
extra.
naturally.
Yes.
You have to be that extra. It's not just a plumbing
Even
job.
men, for that matter. I'm not saying
Yeah.
I don't believe that only women have it, but it just comes naturally.
Once you become a doctor, with
No,
time
we have
that soft touch
soft
in
touch,
you.
yeah.
Motherly, or that's not the right word to say, but kind of that
Compassion.
compassion and empathy is there inside the women. That is mainly driving us towards.
Yeah.
But nowadays men have it too. Okay.
Men have it too, for sure.
Yeah.
True. So, even
So many
as we all
successful
have that.
male interventional radiologists.
Especially me. Okay.
Yeah.
When we started to do a clinic for IR, because it was nobody said, hey, what, a IR clinic, that's unheard of, because they go for surgery but we made it one clinic IR, and I have to fight for it to the top management that I need to have a clinic for that. But by that is the time where you receive direct referrals. That is very, very nice. To see like, hey,
Absolutely.
I've heard about this. Please.
Yeah. Talking about this clinic, so how do you attract patient to your clinic? Because see, first question is, why should a patient go to an IR clinic?
Yes,
I mean, your perspectives. Okay, who wants to start? You can start.
It's just patient, because of the internet and the digital media and the social media, people know the alternatives, and sometimes they don't know that those procedures exist in our country itself, in this hospital itself. So I think social media plays a part, and what you're doing right now is actually plays a big role. Because of you, I might get a direct referral to IR clinic. Yeah,
True. No, that is one thing.
Yeah.
Making patients aware that IR facility is available. The second question being, why should a patient select an IR procedure over any other procedures?
I think the right answer, if you're good, the patients will come to you.
Yes. I'm
Word
asking,
of mouth,
why not a surgery? Why should I come to
I think that
IR
is,
procedure?
that's very critical statement when we are making it that way. It's not like that. it's a choice of the patient to have.
No. See, I'll
Whether-
tell you why I'm asking this
There is
question.
a clear
IR has
advantage.
a clear advantage
Exactly.
over other
Yeah,
specialties.
minimally invasive.
Minimally invasive surgery is the
without a
term.
scalpel.
We have to make people
Yeah,
be aware
See,
about it.
endovascular surgery is essentially vascular interventional radiology. So we use it synonymously where I am practicing. So endovascular surgery is how people have started understanding that vascular interventions and endovascular surgery is like the minimally invasive way. And when we give them options, everybody, I haven't seen anybody who would choose an open surgery over endovascular. But of course, there are cases which would benefit with open surgery.
See, what you're saying is it's minimally invasive, so patients do come here.
Recovery.
Yes, surgery is always an option. So once they come here, we decide whether we can do it through endovascular. If there is not an indication or if there is some advantage of surgery, as an endovascular surgeons or an interventional radiologist, we send the patient to a surgeon.
Agree.
So that
That's-
is why a patient should come to an interventional radiologist.
They come to us
think
first. When we can't do it, then we refer out instead of the other way around.
Instead of the other way around.
Also,
Options should be given.
yes, options should be given. And also the procedures like uterine artery embolization, at least in my practice, it's very difficult to get patients from a gynecologist per se. So I want to know your perspective about uterine artery embolization and how you guys get patient and
Right now
Why-
it's referral basis only, but I think there is a huge lack of awareness, not just among patients but other general practitioners also. People don't know that this can be like uterus preserving operation, to
So-
manage the condition.
So I read somewhere that recently that very high number of hysterectomy is being done less than 40 years of age. So some guidelines have come that whenever less than 40 years, we have to show the document or send a document to the government why the hysterectomy has been done, because that's how rampant the hysterectomy is being happening, which can be
Yes.
easily.
I'm not sure. I'm guessing that sometimes the gynae want to train their trainees, and fibroid. They train hysterectomy through
Through
fibroid. Yeah, because fibroid is a benign disease. It's not like things like in active bleeding. So it's a very elective based cases. Another thing, I think, because when they do laparoscopy, they can do laparoscopic myomectomy. Yeah, but so I think they are hogging it a bit. That's it. Yeah, but I think we have a better outcome and a very simpler outcome compared to doing surgery. Definitely, it's just the lack of awareness.
Yeah, I
Lack
mean
of
everything
awareness.
is just comes back to the same thing. It's
Yes,
lack
it
of
is lack of
awareness.
Lack of
awareness.
awareness.
Yeah,
Yeah.
absolutely.
And also, like, we have to try to have hand in hand with the other specialties, not like yours or mine
Yeah,
attitude.
yeah.
It should
Give
be like
alternatives,
collective
yeah,
effort.
options.
Collective
Yeah.
Teamwork
And-
always. It
Yes.
benefits the patient.
Yes.
It benefits the doctors because good outcome. Patients are happy. They'll get more patients. So it's win-win
And
situation for
even
everyone.
in case of a fibroid, as an interventional radiologist, you can perform an uterine artery embolization, but treating a patient in a gynec background, that can be best done by a gynecologist.
No, but
But
I don't think it.
hand in hand, if both the specialty is working together, when we look at the patient outcome, the best happens there.
Absolutely.
Than debating on it's mine or yours.
No,
Yeah.
true. I completely agree.
Yeah.
I completely agree that teamwork is always working better. But having said that, now we are also so knowledgeable about uterine fibroids and embolization. We independently can manage the entire process unless there is some other issue where I need a gynecologist help. I always take a gynecologist help. Otherwise, I think we all do that. We all.
Yeah,
Oh,
everybody is doing
yeah.
that. Yes.
We also have to step up in our
Yes.
knowledge.
Yes.
Definitely.
I think that's how IR is coming up, and especially women are helping because they are more enthusiastic, more reading into journals and all that. Like,
Yeah.
women are always more knowledgeable than men. I agree.
And also, it's about understanding the ego of the other specialty, other specialist,
Yeah.
and not hurting that and making them understand how we can better benefit the patient care.
Yeah.
So I think that can be done better by a woman with the like non-ego hurting way. Yeah.
Maybe. Okay.
A diplomatic.
Maybe, I agree.
I mean, I would
I
say
agree.
it's just about
No,
giving
because
options.
I don't know what inherent you guys,
Yeah.
how you, even
I think it is just natural.
It's just natural.
okay.
Yeah.
Maybe we are forcing it in, but you're naturally, but both of us are somehow managing it.
Yes.
The one very, very important question, too important, the one going with the first one. So, see, physical strength wise, we are like more capable than any women. So, how does it affect you? Does it really affect women?
Over
when
the
it's-
lead apron. No, yeah, that's the question.
Lead
even I
apron
wanted to
and
ask.
forget about lead apron. She comes at 7 and goes at 9.
It is
some madam
physically
used to do it,
demanding.
a few years back, but now she's reached a stage where a lot of helping hands are there.
Yeah.
But like, how does that actually affect, and how is tell us about that?
It is definitely physically tiring, but then I think investing in good quality lead aprons, lightweight lead aprons, good equipment really helps. I mean, that is something which would actually help rather than investing later when you already have issues. So that is something that I have been following. Otherwise, it's not like it's not like crazy something.
I mean, you are saying that you guys can handle it, not that big.
It's
a deal.
not that big a deal.
I mean, I wanted to ask this question, on keeping this question there. Right now, I'm in my early stage of residency. I am just in the radiology training program right now. So I am looking at becoming an IR after 5 years. But in my early stage, I've been hearing criticism and suggestions in and around all the time, saying like, you're a woman, so you have to understand IR might not be a good opportunity for you, or you have to be worried about radiation. I've been hearing this every day. I'm honest about it, and also about lead apron. Yeah, right. Like how you told me, they were like, you will have to wear the heavy lead apron, and you'll have to stand there all the time. You have to understand the radiation issues and all that. I think so many will be.
No, that was my
there.
second question. The radiation. I'll come to that. The other than that, so now you told that it's not tiring, but then now comes when you have a kid at home.
Oh, it is tiring. Yeah.
So how is it? How did you manage it? So I think future for all women that you can give.
The answer to that question is just don't listen.
People will say what they say.
Yeah, because the satisfaction that you have and the ability that you're going to have later is much more higher than all the criticisms and what ifs that you are facing right now.
Definitely.
But it's physically trying, so you have to eat well and you have to make sure that you can sleep well. It's a skill, to sleep when there's time.
But when
Yeah.
you
Power
have a
nap.
child
Yeah.
at home,
Power nap.
when you have a child at home,
When a child at home, I use a lot of technology. I just spoke to her, like, I use these video calls and FaceTime. Whenever they have a problem, they just FaceTime their mommy. And sometimes while I was doing procedure, and if the patient is sedated, then I talk to them. Okay, what is it you want? Is it urgent? Mommy is scrubbing. Okay. And then they say, oh, it's okay, mommy. Can you help me with this question? Okay, later I'll call you. But the technology is giving us some FaceTime with the child, and all this, and thank God for delivery services and online stuff that we can do, and that's a godsend for working women.
true that. Okay, so now coming to that radiation part, like how worried you guys are, like, and frankly speaking, when I was in my residency working for long hours, I don't know whether it's actually radiation making me. I used to feel a little dizzy, like after working for long hours in the angio suite. So, how is it affecting you, or does it really matter?
I was one of the highest when I was doing my fellowship, and it didn't affect my energy levels at all. Maybe the one is some backaches.
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 Yeah,
That's about
yeah, that's about
That
it.
is why.
But the lethargy part somehow it rolls into another exciting episode. Your adrenaline carries you through.
That's true.
Yeah.
Yeah,
So
yeah.
just go for it. Just bulldoze through it. That's it.
No, but the one question that she was asking, radiation. She's scared.
No, I
people
mean,
are talking.
I'm
No,
like,
people are asking that,
Yes.
like, telling that you are a woman, radiation.
I mean, I have this dream of becoming an IR, and I'm only dreaming that, sleeping and eating, becoming, I mean, like, that dream. So that is not affecting me. But there are residents out there who might have entered radiology thinking that, like, I have to become an IR. But they might back off. But we have to give them an answer.
So what is your
Like,
take on
Again, I would say if you're using like good quality lead aprons and you're using adequate protection, it is the radiation exposure is as much as it is for anybody else. I mean, it's a little higher occupational exposure, but if you keep in check, you wear your TLD badge and you keep a check on all the radiation that you're getting exposed to, that should take care of it. It's not something which should prevent you from following your dream.
That's true.
I think the same take. So when someone talks about the radiation exposure, I tell them that even in the wall of your room is giving you radiation, and if you fly in the air, like your radiation dose is very high. So it's something like
It's
you're
a little
performing
higher occupational
Yes.
radiation exposure, but then don't be lazy. Don't stop wearing thyroid shield.
Yeah,
So
practice
people
good.
become lazy,
you
and
have
then
to take
that
your
happens.
precautions to be safer, but doesn't mean that you
Cannot do it.
Yeah, you cannot do it.
Yeah.
I mean, it's normal. I mean, in olden days, I was told that they used to, even during CT, they didn't have power injectors. They used to give hand
Yeah. Oh my
injections.
God.
And then-
Yeah.
I think you
I
have
did.
experience?
I have that phase, where
Okay.
the injector is broken, and the younger resident will do this. In the
stay
system.
inside.
Yeah, they stay inside.
Wearing
yeah.
lead aprons.
Yeah, wearing
So
lead aprons.
those radiation doses like very high compared to what we are getting in.
And the aprons used to be thick and heavy.
Yeah.
Now it has
Nowadays
become
it's very
really,
nice.
really good. Zero lead aprons and shields. It's wonderful.
I think this is one major reason, the awareness of the radiation part is one thing. I think we'll have to do a separate talk on the radiation alone to attract.
Yeah, we need good people, enthusiastic people in the IR, so that IR can flourish very well. Yeah.
So that was really nice talking to you guys. But at the end, before completing, please give your advice to the younger women in IR or younger women why they should take IR, and like just a motivation to them.
To the girls or the ladies or the women who's interested in IR, I said go for it. Don't listen to all these negative vibes. It is a wonderful, wonderful specialty for ladies, and it gives you so much satisfaction. And be strong, okay, and persevere. That's it.
Great.
I think if you're passionate about interventional radiology, there is nothing that can stop you. People say negative things about everything. So I think focusing on the positive is something which can help especially during the residency and especially when you're deciding. And I think it is a wonderful, very, very satisfying specialty. So this is something, and it is the future also. Minimally invasive surgery is the future. So
That was great talking to two amazing ladies.
Hey, thanks
in
for
IR.
inviting us.
thank you so much for this.
And like they said, it's a great specialty, minimally invasive specialty, and it is the future of medicine. Is what I believe,
indeed, yeah.
and is what every doctor also believes. That's why everyone want to get
Yes,
into
yes,
Exactly.
interventional
Interventional
radiology.
this,
Yes.
interventional
So, and
that.
for the women, these are the live examples that why you should take IR.
Yes,
Thank
go
you,
for
everyone.
it.
Thank you so much.
Thank you.